President William Ruto and his Cabinet Secretary Dr. Deborah Barasa Mlongo must be in shock as we speak. She is in charge of the State Department of Health. Do you remember Grace Njoki, one of those bold Kenyans who stormed a press briefing, is now sharing a painful story after complaining over Social Health Authority. I want us to listen to her painful story before we proceed.
I had gone to seek for treatment at London Hospital because I was sick, and I'm so a security person who I had seen earlier in Kenyatta, and I even asked him, "What are you doing here?" So I sensed that I was being followed, and he claimed he had a patient, and I can identify even when I see him. That time when I went to collect my results, I saw him, and he appeared from nowhere and he greeted me. So I told them I was coming to collect my results because they were inquiring what I had gone to do. So when I saw him at London, I was uneasy, but he claimed he had a patient. Less than 10 minutes later, and a lady, and they told me they wanted to take me somewhere. I asked them what I had done or where they were taking me. They refused to tell me. I asked them, why are they arresting me? They refused to tell them. They told me I was not being arrested. Then I asked them, why do you want me to go with you? So one of them, the gentleman, actually there were two. They told me, upende usipende utaenda, utatoka hapa. So I felt threatened. And I asked the lady, where are you taking me? Why are you coming for me? They did not clarify. And then I asked them, why are you arresting me? They did not clarify anything. They just told me, upende usipende ujue utaenda. So now is when, after that is when I called my son. I told him what was happening, and I called my husband. And they grabbed my phone. They took it from me. And since then, I have not seen my phone. So the hospital tried to intervene. And because I was going for medical treatment, they tried to intervene. But the other officers stormed in from Pangani police station. That's what I understood. There were over 20 officers. They carried me, they manhandled me. I was carried by force out of the hospital where I had gone to seek treatment.
Shame.
And I was dragged, I was pinched, I was bullied. And all through, they never told me where they were taking me or why they were arresting me. Then they were insisting I write a statement, so I asked them about what. Nobody told me anything. So all through that time, I was feeling threatened. I have a heart condition. So I kept telling them, let me talk to my lawyer, let me talk to my son. They had my phone, they refused. And the only time they allowed me to talk to my son, they used their phone, but I realized they had not called my son when they said that a woman had picked up the phone. So I knew they were lying. Then they drove around town, and I ended up in, I think it's somewhere, it's called another building, I don't even remember. They took me in, I stayed there for a few minutes, then they changed again. They took me to 3 different locations before I ended up being here. But my question was, I asked them, if I have done anything wrong, why don't you just tell me? I come to the police station, I write my statement, I'm seeking medical treatment. They refused. And they told me, utaenda, upende, usipende. Actually, I felt I was being abducted because that was my fear. That is what I felt. Because I do not know why I was arrested. To me it's not arresting, to me it's abduction. Because I had gone for treatment. So could they not wait for me to finish my treatment? They know where I stay because they told me, even we know your house, we know where you're staying. Could they not even reach out or call me because they had my numbers? Could they not reach out to me and tell me, we want to talk to you, come to our offices, instead of coming and manhandling me when I'm seeking medical treatment in a hospital? It is very unfair. It is very wrong. And me, I still insist, and I still say I just came to fight for the patients who had no voice. I am not a political leader. I am not looking for anything. I'm a nurse. And all those people who know me, I have always fought for patients' rights. That's all I want. Give the patients their rights. Let them get their proper treatment. Stop taking the money and you don't give the treatment, because that is what is happening. And I saw many patients, as our Honorable MP Manzu has said. I met many patients. I had no even patients who kept telling me they are paying that SHA, they are paying treatment from their pockets. It is true. I even encountered some patients there, they told me they have a bill of 2 million and SHA only paid 2,000. What is that? Another one had a bill of 400,000, SHA paid 1,000. What is that? Me, it is not about me. I am sorry, it is not about me. It is about doing what is right to the patients and to the Kenyans. And even when I went to that office, I never addressed anybody. I just said, I am fighting for the Kenyans. Do what is right. We are asking questions. That is all. Thank you.
Walikukamata kabla hata hujapokea matibabu, hali yako ikoaje? Umelala hapa usiku yote?
Sorry?
Nauliza hali yako ikoaje kiafya?
Mimi hata I took painkillers. Nimeleta dawa na my brother. So basically I was supposed to go to theater. I don't even know whether they'll approve my SHA. I don't even know whether that hospital will accept me after this. You. I don't know if that hospital will, but I thank the hospital. They tried to intervene, and the police officers stormed in, and they told them we have to go. They stormed in their office. Actually, I was waiting for my lawyer to come. We were ready to come, but they stormed in and abducted me. That's what I'll say.
That is exactly what happened to Grace Njoki. Were it not for Senator Dan Manzo, lawyer Ndegwa Njiru, and other bold Kenyans, maybe leo tungekuwa tunasema story tofauti. Why must Kenyans suffer? This is something that President William Ruto and his cabinet secretary, Dr. Deborah Barasa, cannot take for granted. President William Ruto is interested in social health authority, and there is no way they are going to fail. In case this is your first time on the Sport Check YouTube channel, kindly support us by subscribing and turning on the notifications bell. We are on a mission to 6,000 subscribers before the end of this month. And if you are a returning subscriber, thank you so much for supporting this YouTube channel. Now, Kenyans must understand, even MP PK Salasian told President William Ruto nothing but the truth in Mumias East constituency, that those who are close to him are not telling him the truth. Social health authority is a problem to many Kenyans as we speak. And health is very important. It is like education. It is very important. Any government must be in a position to take care of the health of its people. There is no way that CS Deborah Barasa Mlongo can run away from this problem. Now, what is shocking Kenyans? What was the most important part of arresting this woman, Grace Njoki? Was it necessary? I thought the most important part of this story was to take care of those patients that are complaining about social health authority. That is the reality on the ground. So it is a shocker to many Kenyans. It begs a question. How many Kenyans will suffer? Somebody in Kanyadhiang. I know you don't know where Kanyadhiang is. Someone who doesn't know Lawyer Paul Ndegwa Njiru. Not Lawyer Paul, but Lawyer Ndegwa Njiru. Someone who doesn't know Senator Dan Manzo. Someone who is not in a position to maybe access media. What will happen to those people? It is shocking. And the head of state cannot run away from this. They just have to fix social health authority. I did a video about this story last week. It is said that what the head of state together with the State Department of Health must do, they must identify the problem. Dr. Deborah Barasa Mlongo is a medical doctor. She knows very well that for you to know what a patient is suffering from, you must listen to their story, you must carry out further investigations. Maybe you take a blood sample, you take it to the lab, then after that is when you can give medicine. Sasa hata wao wenyewe, they have to come out, identify where the problem is. Why is it that the Social Health Authority is not working? Is it because of the funds? Is it because of the personnel? Kuna watu wamezembea kazini ama hawajazembea? After knowing the problem, they must now work on the Social Health Authority. How many patients will continue to suffer? And why are they being arrested? Because it is their government. I thought this is a government of the people. The president has been saying, hii ni serikali ya kila mtu. So Kenyans are not complaining. In fact, they just want President William Ruto's government to succeed. But this is a painful story. Kenyans should not go through this. So I think the government must now come out and work on Social Health Authority. Now I promised at the end of my videos to carry out civic education. This is what you need to do. You need to register as a voter as soon as possible. And the beauty of being a registered voter is that you can participate in two types of elections. One, general elections. Two, by-elections. And you can only do that if you are a registered voter. Number two, let me speak on something on that being a registered voter. 2027 Kenyans want President William Ruto to go home. You cannot take William Ruto home without being a registered voter. So register yourself as a voter first. Number two, you remember to demonetize politics. And once you demonetize politics, that will be good because you will not get leaders who will steal public funds. And that is what Kenyans are fighting. Then lastly, remember to vote for someone with a vision. Don't just vote for someone who is visionless. Your ward, constituency, county, and the country will lag behind in terms of development. I told you earlier that we are on a mission to 6,000 subscribers before the end of this month. Kindly support us by subscribing and turning on the notifications bell. We are on a mission to make sure that you get news